Dr. Jaffe, what is type 3 hypersensitivity?
Well, type 3 relates to Jellincombe's 1967 differentiation of immune type reactions. And type 3 are the most interesting, the most unusual, and potentially the most harmful. What does type 3 clinically relate to? Glomerulonephritis, temporal arteritis. Because if there is foreign antigen in the blood, it should get filtered out by the liver, the spleen, and the kidneys. But what if there's so much digestive and other foreign material coming in and burdening the immune defense and repair system that antigen, foreign material, continues to circulate? And the body recognizes this as foreign and makes an IgG antibody against it, but this is a complement-fixing antibody, and this antibody-antigen complex will damage blood vessels and the kidney, also the liver and the spleen and the heart and the lungs, but especially those. So type 3 reactions are very important to detect, and they can only be detected by an LRA, a lymphocyte response assay cell culture. Why? Because in the cell culture, all the components that are needed for the immune complex to show itself are present. If you isolate cells, or if you only look at serum antibody, you'll get confused. If you do a true cell culture, you can detect type 3 reactions as well as type 2 meaningful antibody and type 4 T cell reactions. And then there's one more piece of this story that I want to reveal. In addition to the foreign antigen antibody complex, the body makes an IgM, which is a very big molecule, makes an IgM to wrap around the IgG antigen complex to prevent it from damaging blood vessels and fixing complement and hurting the kidneys, etc. So that's what type 3 reactions are all about, and that's why the LRA by ELISA Act, the LRA system, distinctively detects immune complexes. And that's why, among other reasons, LRA by ELISA Act is so important for clinical best outcome in autoimmune, in cardiovascular, in chronic toxin, in immune defense and repair burden syndromes. So thanks for asking. I hope you now understand type 3 hypersensitivity or type 3 immune complex reactions.